Cervical cancer. What is cervical cancer? It is basically the fourth most common cancer among females and among females of all the races. So basically, there is a racial uh, differentiation, or I would say disease burden among different cancers of females. But among females, if we speak about cancers, cervical cancer is fourth most common cancer that is common in all females of all background or all ethnic races. So uh, moving to the learning outcomes of the cervical cancer. First of all, we need to understand what is cervical cancer. At the end of the lecture, you will get to know that that how what is basically cervical cancer is, what are the causes and risk factors of the cervical cancer, stages and progression, global impact, facts and stats of the cervical cancer, screening and early detection methods. So basically, at the end of the lecture, students will be able to understand what a cervical cancer is, or what is basically the cancer of cervix, different types and stages, and how it progresses, its causes, risk factors, disease burden, and screening and early detection methods. And we are going to talk about a little bit about the treatment of the cervical cancer. Moving forward with the lecture, okay, here is a little bit of anatomy and the function of cervix. So basically, in the right side of the slide, you can see the diagram of the female reproductive tract. So this one here is the uterus. This is the ovary, which is the female gonads. These are the fallopian tubes. This structure right here is the cervix, and below the cervix, this is the terminal, or I would say the closure of vaginal canal. So basically, what is the cervix of uterus? Cervix is basically a narrowed lower part of the uterus that is opening that connects vagina with the uterus. So it basically acts as a protective barrier, preventing infections ascending from the vagina towards the uterus. So in case of sexually transmitted diseases, which are very common in young sexually active females, but they are usually limited to the cervix or vaginal canal or external genitalia. But uh, what is the structure that basically prevents the infections from ascending up to the uterus? That is cervix. So in most of the cases, infections do not ascend, but in some cases like chlamydia infection or some other infections, the infection ascends usually to the uterus or the pelvis of the female. So that would convert an STI into the pelvic inflammatory disease. So this was a brief overview of the structures of the female reproductive tract that is directly or indirectly linked to the cervix. Cervix literally means neck of something. So basically, it's a neck of the uterus. During pregnancy, basically it maintains the integrity of the uterus. So it just shuts its mouth. It's the opening of its opening until the pregnancy reaches its term, and then it dilates to to let the fetus out. So so there are cases in which there is a issue of the patency of the cervix. So cervix is not patent enough to hold or to constrict or to keep the uterus closed. So in that cases, miscarriages often happen. Another another function of the cervix is to produce a cervical mucus, which has a very important role in reproductive health and fertility. So in normal days, the cervix is tightly closed, and a mucus plug is, I would say, produced and inserted in the opening in this central area. by the cervical secretions, and that's why usually in non-fertile days cervix is kept closed, but in usually the days of ovulation or mid-cycle the cervix usually opens during the days of ovulation. Thus mucus plug that is inserted or secreted here lightens, or its consistency is lowered to make it more fluid like instead of semi solid something or jelly like. So this is how it produces, it has a very major and important role in fertility. So this topic is going to be very I would say serious topic. This is going to be an adult discussion about various problems associated with the cervix, and how we can protect ourselves, our females associated with us, with with the proper systemic approach. So what is a cervical cancer? Basically cervical cancer originates from the internal lining. This here, the lining of the basically this round structure is the cervix. If a female is examined by the during colposcopy, this is how a cervix is visualized. This is the opening in the center. So cancer originates from the lining of the cervix. Basically lining is the I would say the cellular structure, the cellular covering of the cervix. That's where the cancer takes origin from. The most primary cause of the cervical cancer is human papilloma virus, HPV virus, which is basically a type of virus that causes infection in humans and reproductive tract of human. Mostly it can cause genital warts, or it can be associated with different manifestations, but the main cause of cervical cancer is HPV virus. And among HPV virus there are different types of the viruses, even in HPV virus types. So type 16 and type 18 are the most commonly associated with the cervical cancer. Precancerous changes, we call it cervical intraepithelial neoplasia, CIN. So basically this is a stage that is the stage that happens prior to the actual cancer and can take years to develop into the invasive cancer, allowing ample time for detection and intervention. So precancerous changes are the changes that are usually predisposed before uh, cancer actually sets in. So, cervical intraepithelial neoplasia (CIN) is a term that is used before for the dysplasia, or I would say the changes that would eventually turn into the cancer. So, it is not necessary that females undergoing for the screening program will be like showing up for the cancer exactly, but there will be a series of growth changes, or I would say different stages of CIN, that is cervical intraepithelial neoplasia, which is a precancerous state that will lead to the cancer eventually. So, with the screening, with the timely screening and intervention, uh, cervical cancer can be cured, or I would say this precancerous stage will be cured. Then cancer will be automatically, or I would say will be avoided. To so prevention is better than the cure always, as said. So what is CIN? Cervical intraepithelial neoplasia. Basically it is a precancerous stage that leads to the cervical cancer. So there are different stages of the cervical intraepithelial neoplasia. So better and earliest as possible approach is always preferred. So as like other cancers, cervical cancer definitely it metastasizes to other areas, but if detected early, even in this stage, this CIN stage, precancerous stage, then it will be cured very quickly, or I would say very swiftly can be managed with minimum symptoms, or I would say minimum invasive treatments. If untreated, it can metastasize to nearby tissues and distant organs. That is definitely the outcome of any type of cancer, usually invasive or non-invasive. If you keep any type of cancer untreated, it will definitely metastasize either by local invasion to the nearby structures, or by to the different organs through the blood or lymphatic system. Next, we're going to talk about the causes and the risk factors. There are there are modifiable risk factors and non-modifiable risk factors, and then there is a primary cause. So, as I already said, that the primary cause that usually sets the base for the cancer is HPV infection. So even there are other types as well, like HPV 9, 11, but the high risk HPV types are HPV 16 and 18, that accounts for over 99% of the cervical cancer cases. Speaking about the non-modifiable risk factors, that there is, if there is genetic predisposition, then this would be a non-modifiable risk factor. Then any female with first degree relative or second degree relative having cervical cancer will be having more chance of getting cervical cancer as compared to those females who do not have any family history or do not have exposure to the HPV. Then there is a history of precancerous cervical lesions, that I already told, that CIN, cervical intraepithelial neoplasia. So if a female had a history of either family history of cervical cancer or history of a previous precancerous lesion that she got treated, but she would still be at risk even though that lesion is completely healed, but there might be a chance that she might grow that cancer in any stage of her life if she gets immunocompromised, let's suppose. Then there are modifiable risk factors. Modifiable risk factors are like things that we can control, and with the help of that control we can modify the disease burden, or modify the probability that we might get cancer or not. So that consists of immune system, long term use of oral contraceptives, poor hygiene, and nutritional deficiencies. So these all are the modifiable risk factors. Basically, smoking causes carcinogens in tobacco. Hello, can you guys hear me?
Seems like we lost the presenter. Dr. Yamila, are you there? Because I see you online.
Uh,
Yeah, it seems we can hear you now.
okay, all right.
But I suggest you mute your other computer or cell phone so we can hear the echo of the presentation.
Can you hear clearly now?
Okay.
Okay. Sorry, everyone. I just got disconnected from the internet. So let's get back to the causes and the risk factors of the cervical cancer. So, what are the primary causes of the cervical cancer, which is HPV 16 and HPV 18, which accounts for over 99% of cervical cancer cases? So, there are other types of HPV viruses as well, like HPV 9, 11, uh, probably 13 as well. But these or I would say different type of HPV viruses or different variants of those viruses that cause mild disease or mild manifestations either in the form of genital warts or other diseases. But the HPV 16 and HPV 18 accounts for 99% of the cervical cancer cases. So these two strains are high risk HPV types. Then we're going to talk about non-modifiable risk factors. Non-modifiable risk factors are basically factors that we do not control or we cannot control. So, a family history of cervical cancer is a non-modifiable risk factor. First degree relative or second degree relative with the cervical cancer history will put you in a tough spot for the cervical cancer as compared to the females who do not have a do not have a cervical cancer history or do not have an exposure to the HPV virus. Then there is a history of CIN, as I already told. It is a precancerous lesion or precancerous wound. So, if a person has a treated or untreated precancerous lesion that I already told, that is cervical intraepithelial neoplasia, CIN, then she can be at a high risk of developing cervical cancer. Moving to the modifiable risk factors, smoking, early sexual activity, multiple sexual partners, weakened immune system, long term use of oral contraceptives, poor hygiene, and nutritional deficiencies. So, either one way or another, directly or indirectly, these these are the risk factors that contribute to the cervical cancer. So sexual activity would lead to the more exposure to the HPV as compared to the delayed onset, because in early teenage years, young people do not have that much exposure, I would say, capacity to understand these things, or they do not have much information about these diseases or these risk factors. Multiple sexual partners can also be a major cause for HPV transmission. Immunocompromised persons such as with the HIV infection or person with a recent transplants or going on immunosuppressive therapy can also develop cervical cancer. Oral contraceptives long-term use more than 5 years can also be a risk factor for the cervical cancer. Poor hygiene and nutritional deficiencies can also make susceptible to develop any kind of cancer. Speaking about the stages and progression of cervical cancer, there are basically four stages, starting from the stage 0, 1, 2, 3, and 4. So in stage 0, abnormal cells present but have not spread. So basically, it's just a couple of or a cluster of cells that is present that are abnormal in shape or abnormal in size that are present, but they have not spread to any nearby areas or not causing any harm. But they are not normal cells. This is carcinoma in situ, stage 0. Then comes the stage 1. Cancer is confirmed confined to the cervix. So this is stage 1. This is cervix, and this is the tumor here. So basically it's a, I would say, a tumor of that we can see with naked eye, that is present, that might or might not be obstructing a normal structure of the reproductive tract, normal opening of the reproductive tract, which is cervical opening. This is stage 1, which means it has not spread yet to any lymph node, any other organ. So it is stage 1. In stage 2, cancer has spread beyond the cervix but not to the pelvic wall or lower vagina. So in stage 2, basically it spreads to the nearest lymph nodes. This is the lymph node nearest, and this one is the lymph node. So in stage 2, basically the first tumor, primary tumor, is in the cervix, and it is mildly spread to the nearest lymph nodes that are draining lymph from the uh, reproductive tract. Then comes the stage 3, in which cancer has spread to the lower part of vagina or pelvis as well. Either way, either cancer has spread to the reproductive tract, either in the uterus, in the fallopian tube, or in the pelvis, or in the vagina. Plus, as we have moved from stage 2 to the 3, so lymph node positivity is also present already, which means lymph nodes are already positive, but cancer has spread to the other areas as well. In stage 4, cancer may have spread beyond the pelvis to other organs such as liver, abdomen. It might spread to chest or other areas. So these are different stages of cervical cancer. This is how cervical cancer progresses. Next is global impact or global disease burden of the cervical cancer. It is a fourth most common cancer, as we already discussed. Over 600,000 new cases and 3 lakh 40,000 deaths occur annually, as per stats of WHO 2023. HPV causes 19 early, nearly 99% of cervical cancer cases. So it is highly unlikely that without the history a patient comes up with a cervical cancer. In maximum cases or majority of cases, 99% of the cases, a patient must have history of HPV, whether diagnosed or undiagnosed. So with the screening and vaccination in developed countries, there is a significant decline in the cervical cancer stats, but in developing countries there is a still graph is, I would say, exponential, because there is no such measures have taken either in the form of vaccination or proper awareness campaigns. So there is a disproportionate burden, disease burden, due to the limited screening programs as well. So in developed countries, there is a definitive screening program. There is HPV vaccination. There is regular screening, I would say, with follow-ups. So there is a sharp decline in the disease burden. So what are the symptoms and signs, warning signs that might be linked to the cervical cancer? So early stage cervical cancer is often asymptomatic, and women do not have any difficulty or discomfort, whether uh, during the intercourse, or uh, if the female is in the childbearing age, she can she can be perfectly fertile or be having children, so without any sort of sign and symptoms. So early stage cancer is usually asymptomatic. As the cancer progresses, symptom might include abnormal vaginal bleeding, which can be postcoital, intermenstrual, or postmenstrual bleeding. So these are different bleeding patterns depending on the age of the females. There can be pelvic pain or lower back pain, pain during intercourse, which is called dyspareunia, uh, unusual vaginal discharge, which can be foul smelling, which can be watery or bloody. So there can be different type of manifestations or different, I would say, type of discharge that can present or linked to the, can be linked with the cervical cancer. So it is not necessary that foul smelling discharge can be cervical cancer. It can be an STI as well, but cervical cancer can also present with foul smelling discharge, can be watery or can be bloody. So other symptoms that are associated with the I would say pressure symptoms that can be associated with the tumor can be increased urinary frequency or difficulty urinating, because tumor might be pressing your bladder or might be pressing against your urethra. So uh, females can have difficulty while urinating. So leg swelling can be present, as we discussed that from the stage 2 and onwards. Cancer may have spread to the lymph nodes of the legs. So, due to the lymph node involvement in advanced cases, lymph or I would say edema develops in the legs. So, leg swelling occurs. What are preventative strategies that we can deploy to cope up with this? So, number one is HPV vaccination. So, yes, there is a vaccination. There is a vaccine available uh, for the HPV various type of strains, but it is usually effective if given as early as possible, even before sexual debut, which means a female who is in puberty but is not sexually active yet. Like as I mentioned, the age bracket 9 to 14 years of the age, so it is a perfect age for the vaccination of HPV. Safe sexual practices with the use of barrier methods, but it still cannot 100% eliminate the HPV risk. Smoking cessation, it reduces cervical cancer risk, whether with or without HPV. Balanced diet and physical activity, definitely it boosts immune defenses against any type of cancers or infections. Next comes the screening and early detection methods. So some of you might be aware of the pap smear test. Usually it is recommended every 3 years for the females aged 21 to 65 years of age. It might detect precancerous or abnormal cervical cells. So, with the help of regular pap smear test undergoing 3 year every 3 years in females of 21 to 65-year age bracket, if there is any sort of precancerous or abnormal cervical cell seen, so early treatment will be deployed to you know to kill the abnormal cells or any sort of cells that look suspicious, so it would not transform into the cancer. Next type of test is HPV DNA test. So it is not as common as pap smear test, but it is recommended every 5 years for women aged 30 to 65. Identifies high risk HPV types. So basically, it is a more specific test for the high risk types such as HPV strain 16 and 18. Then comes the colposcopy and biopsy. So usually these two are reserved for the advanced disease such as advanced tumor or large size tumors, or the tumor that has grown like significantly and there is apparent lesion or wound on the cervix showing significant dystrophy or significant change on in the appearance of the cervix. So colposcopy can see the gross structure of the cervix as a whole or by naked eye, and biopsy is taken to confirm the histopathology of that tissue, or I would say the type of if we take the biopsy of the tumor and see in the under the microscope, it would likely show the abnormal cells that we might be expecting if it is a case of cancer. So HPV vaccination, it is 100%. Sorry, it's not 100% effective, but is highly effective in preventing HPV infection and associated any type of cancers. And it is recommended for both males and females. Yes, for both, to reduce the transmission. And there is a significant decline as per stats after the vaccination in cervical cancer cases. Treatment options, there are two type of basically treatments. uh, First one is early stage, the next one is advanced stage cervical cancer. In early stage we usually do a cone biopsy for the precancerous lesion. If a lesion or the wound or the cervical cancer or precancerous lesion is too small, or I would say even if a size of kidney beans size, we usually do a cone biopsy. Cone biopsy is basically a surgical excision of the wound in the shape of cone. So it uh, it goes broader on the superficial level, but as the knife goes down, it goes to the, I would say, it narrows down like a cone inside the tissue. So that is cone biopsy for the precancerous lesion. Next is hysterectomy, removal of the uterus if a female is beyond reproductive age, or if they do not, if they do not wish to have children. So a better and safe option, even better than the cone biopsy, is hysterectomy, total hysterectomy with the removal of the cervix. Next is advanced stage cervical cancer. But if cancer is advanced or metastasize to other areas, other organs, lymph nodes, so radiotherapy and chemotherapy will be a better option for the tumor shrinkage and symptom relief. So that would be a type of palliative care. Next comes targeted therapy and immunotherapy. So these are relatively new therapies, like monoclonal antibodies or immunotherapy, targeted therapy against the specific type of cancers to improve the survival rates in advanced cancers, which can't be cured surgically or can't be cured completely by orthodox types of radiotherapy or chemotherapy. So, what is the takeaway message? Basically, cervical cancer is completely preventable through HPV vaccination and regular screening. So, unlike other cancers such as ovarian cancer or breast cancer, cervical cancer is totally preventable. Early detection significantly improves survival rates. Educating communities about risk factors and prevention is important, because education is really important, and so much as awareness about these type of cancers is, because if people are aware about the disease, then they will seek active screening after the regular periods, so the disease will be detected early and managed accordingly. Next come seek medical advice if symptoms arrive. So basically, if you are symptomatic, if you do not, even if you do not have a history of a first degree relative or second degree relative history with the cervical cancer, if you do not have a infection or history of HPV infection, but if you are aged above 20 or 30, and you have to undergo screening every 3 years for cervical cancer. So because as much early as you go you undergo the screening process, it will help you get better with the very, I would say, excellent prognosis. So HPV screening is only helpful if you are not diagnosed yet, or if you have any sort of precancerous lesion, if you are unaware about it, and screening will help you out. But if you have symptoms, if you have active symptoms of any sort, like if you are having any sort of growth, if you are feeling any discomfort, if you are feeling any sort of discharge, so you should see active medical intervention, because in that case, screening will not be helpful. The next step will be treatment. So as I already said, that treatment should be availed as soon as possible. But even better than the treatment, prevention comes first. So prevention is always always comes first. So that was a takeaway message. I hope that makes sense. So these were a few references I took my data from, because cervical cancer is a very vast topic. So I try to stay relevant as much as possible. So if you have any questions, please feel free to ask.